There we go. Well, hello, everyone. My name is Darren, and I'm one of the marketing coordinators for BCIT's School of Health Sciences. It is my pleasure to welcome you to this online information session for the Health Leadership Advanced Certificate Program. I want to say how happy we are to see you all, and thank you for attending our presentation today. And feel free to post any questions or comments into the chat during the presentation, and we'll address as many questions as we can near the end of the presentation in the Q&A segment. And just before we get started with the presentation, I want to say that the British Columbia Institute of Technology acknowledges that our campuses are located on the unceded traditional territories of the Coast Salish nations of Squamish, Tsleil-Waututh, and Musqueam. And now I would like to call up Shan Shadoglu to introduce the department and speak about the program. Thank you, Shan.
Hi, everyone. My name is Shan Shadoglu. I'm the program head of the Healthcare Management Department at BCIT. And I'm here to speak about the Health Leadership Advanced Certificate Program. So as you've seen in the invitation email, that this session we describe it as a roundtable information session. So I will be speaking for a few minutes, and then we will have some time to talk about the program. So in our department, our vision for our role at BCIT is that we inspire and educate health leaders who wish to develop their leadership skills, their management skills, and to foster a positive change for a sustainable health system. We are one of 35 programs in the School of Health Sciences, and our focus is working health professionals who have gone through that early stage of entering into a health profession and are now at a place where they're looking to advance themselves in their organization or in other areas of their practice. So this is the format for this evening. We're just getting through some welcomes right now. We're going to do a bit of an introduction because this is on Zoom and people may be in a kind of an appropriate environment to interact on Zoom, but others might be possibly at work or possibly in the clinic or in other sort of settings. We're going to do a bit of introductions using the chat tool here in Zoom, and then I'll be speaking for about 20 minutes, and then we'll have some time for a Q&A. So that's the format for this evening. So let's go to the next item on our agenda, the Zoom chat. Could I ask everyone for a bit of a favor? Could you please open up the chat tool at the bottom of the Zoom screen if you can, and just submit a post and indicate what is your role in healthcare, your academic background, and your location. Where are you dialing into Zoom from? Let's have a bit of sharing, and then I'll kind of relay some of that back to us to see who's in the room, the virtual room, and then we'll get started with the presentation. So, and I'll do the same. I'll type into chat, and I hope some of you can reciprocate. Hey, let's see who's shared a bit of the chat. Harley, radiology services technologist, MRI clinic in Abbotsford, BCIT alumni, biomedical, 2009. Hi, Harley. Michelle's posting, based in Victoria, working as a hospital porter, background, biology and sociology, bachelor degree. Alicia, a registered psychiatric nurse in community mental health, calling from the unceded territory of the New Tribal Council peoples on the west coast of Vancouver Island, Euclid and Tofino. Hi, Alicia. Let's see who else is here. Carrie, sonographer from Alberta. Hi, Carrie. Okay, and let's see. Let's take a couple more minutes. Let's share some background. Mariana, hi Mariana. Bachelor education, medical biology. Oh, wow. In the recovery field with trafficked women and their children living in Surrey. Ola, thank you for sharing. Medical background in MBA, medical clinics, genetics, clinical specialists. Jivan, in Vancouver, BA in Health Sciences, minor in gerontology, working in clerical at BCH. Okay, great. Thank you all for sharing. It's really interesting to see the range of backgrounds, people who are interested in this program. And as you'll see later on, we have quite a cross-section of health-related occupations and professions of people who are interested in taking health leadership. It actually really adds to the diverse mix of the student body and to the learning, which is quite often it's different from what one normally encounters in their first credential, where people are often all kind of getting the similar background and similar training. So thank you for sharing. Let's move on to the next part of our info session. Yes, so this is the vision of the future from our department's perspective. So we believe that in the future, healthcare is going to be even more patient and family centered. So moving from a kind of a patient only and not really thinking about the rest of the social system around them. So more patient and family centered. Maybe less provider oriented, but more patient oriented, more prevention oriented, more focus on accountability, more interprofessional teamwork, team-based care, and because of the demographics, focusing on an increasingly older population. So the question here is, as you think of how healthcare will evolve into the future, who are going to be the clinical and the non-clinical leaders in the Canadian health system? So in Canada, we're really proud of our health system, and oftentimes we compare ourselves to our neighbors to the south because of the accessibility of our system and the general health of our population. But on an international ranking scale, Canada is, we're certainly not near the top of the list. We're kind of doing okay, but certainly not one of the best. So this report, this chart is from the Commonwealth Fund, which is an international body that does rankings of health systems across the globe. And as you can see in this table, Canada is ranked 10 out of a total of 11, with the US at the bottom, and these other Norwegian countries ranking quite a bit higher in certain areas. So, for example, the care process, efficiency, those are some areas where some other countries are ranked higher. And Canada is a little bit lower on access, equity, and health outcomes. So every few years, the Commonwealth Fund produces a new report. Probably the next one is coming within a year or two. It's really interesting to see how we compare with other major developed countries, in addition to the United States. Okay, so another way to look at where healthcare is heading is to look at a regional level. So this is an excerpt of some key strategic goals for the Ministry of Health Services Plan from now until 24-25. So oftentimes, if you want to see what's a priority, is to look at what takes up the most amount of space on a page, or the sequence of goals that are listed. So in this case, goal number 1 from the provincial government here in BC is to focus on service delivery areas that require strategic repositioning. So this is about rejigging the availability of the provision of services to emphasize certain areas of care, like primary care and integrated team-based care, seniors, mental health, substance abuse, and so on. Goal number 2, focusing on the health and well-being of all of BC through high-quality health services. So focusing on equity, population health prevention, and continued improvement of services that are hospital-based, pharmaceutical, lab, and diagnostics. Goal number 3, sustainability. So making sure that the public dollar is being used effectively. This also involves reducing the sort of friction that might occur between different health professions. So having a sustainable, engaged, and skilled workforce, and also looking at health sector innovation. So the health sector is a huge component in any provincial economy. And with all the work that's happening to deliver services, are there ways to learn from that and to come up with new products or new innovation that could be marketed and produced or exported. So these are some of the high level top three goals from Minister Dick's ministry for the BC provincial health system. So as a leader, leaders have to think about where the system is heading and what the future involves. And so being aligned with some of these key themes is really important in terms of aligning one's personal aspirations as a health leader with changes that are coming in the system and need to happen in the system. So speaking of leadership, this is a quote that it's pretty, it's a little bit comical. Warren Bennis is a kind of a classic thought leader, organizational behavior theorist. He's done quite a bit of writing about leadership from the 80s and beyond. So his kind of tongue-in-cheek explanation of leadership is it's like an abominable snowman whose footprints are everywhere, but who is nowhere to be seen. So this is sort of like when something goes wrong and you look at the newspapers, it's easy to point a finger as to, if we just had better leadership, all the problems would be solved. But actually, the reality is much more complex than that. So if you go to Amazon.com or Google Books and look up leadership and flip over to the image view, you will see so many popular books, textbooks, notions and definitions of leadership, from Leadership for Lawyers, Quantum Leadership, CIO Paradox Leadership, leadership from Attila the Hun, Ethical School Leadership, Leaders on Leadership, and on and on. It's actually a vast, complex space with no direct, easy answers. So this is part of one of the exercises in the first course in our health leadership program, is to kind of think critically about this from a theoretical, but also personal, experiential perspective, and come up with a notion of leadership that's unique and meaningful to you. Here's one that I like. Leadership is accepting responsibility for enabling others to achieve a shared purpose in the face of uncertainty. Okay, so let's switch gears here a little bit and look at the Health Leadership Advanced Certificate and its role and history at BCIT. So healthcare management as a department at BCIT has been part of our school for 30, 40 years. And so you can see the history of our department in the 1990s up till the mid 2000s. BCIT ran a healthcare management certificate level 1 and 2 program. This used to be like a night school program where on the weekend, people after work would come in and do some intensive classroom work and then write their exams and get their certificates. In around 2000, our department took a different direction. This was a time when e-learning was just getting started. E-commerce, e-learning, e-this, e-that. It was the next wave in learning for continuing education and health professionals. So at that time, we launched 3 new online programs: clinical research, health informatics, and healthcare quality management. And then in around the late 2010s, in 2013, as a department, we decided let's consolidate our learning to date and look at what are the core underpinnings that enable many of these different areas of study. And with consultation with industry and looking at literature, we decided to make health leadership the flagship theme for the department. As well, we launched a new program, the Health Leadership Advanced Certificate, online in 2013. So in terms of who is taking our program, this is the pie chart showing some of the distribution. And once again, thank you for sharing some information about yourselves. It's really interesting to see how people come to an area of study like this and where they kind of originated from. So you can see in this pie chart, on the bottom left corner, Diploma of Technology and Health Sciences, about a third of our students have that sort of background. And that really reflects the teaching and learning that happens at BCIT in health sciences at the undergraduate level. We also have people with a baccalaureate background, either in health sciences or in another field. That's another 20%. The nursing profession is a large component of our students. So with the BSN background, BA and BSc in health sciences, we do get candidates for our program coming out of SFU, often with a laboratory health sciences background or kind of a public health background, a BA, and interested in how to relate that to a career path that we're usually involving management and administration. We also have some people in the program who are master's trained, so MPH, MSc, in a variety of health sciences areas, some people with a nurse practitioner background and others. So that's around 6 or 7%, and then a few other people who are crossing between different sectors, but related to health. So you might see yourself in that sort of distribution somewhere. So another dimension here is, what are the areas of study? What are people's expertise in? So this is a list. Comes out from some of the surveys that we do in the program. You can see the bullets in blue: nursing, X-ray, MRI, clinical genetics, biomedical engineering, technology, radiation therapy. These are areas of study that people finish their undergraduate in at BCIT. So after people do an area of study like that and graduate, they are basically a BCIT alumni, and then they might come back to do studies in health leadership. But in addition to those disciplines, you'll see these other areas: public health, nurse practitioner, new ventures, pharmacy, physiotherapy, gerontology. So a large number of other professions and occupations also are interested in the health leadership program. So it's a really great mix of different perspectives. In terms of age background, people are kind of at past that stage of one's career where they're kind of sorting out how to get started, getting into really important work, and maybe even supervising or kind of guiding some juniors in the department in one's area. So people are kind of in their mid to late 30s with quite a significant number of years of experience, but still quite kind of a runway ahead in terms of advancing one's career with an injection of further studies. And could you, Darren, just go through a few times until this is filled in? Yeah, thank you. Great. So in the old days, one usually thinks of getting a credential, starting in one's field of practice, maybe getting an advanced credential and digging in more deeper in the area of practice. But certainly learning is no longer just getting one credential, practicing, and that's it. It's really part of a lifelong process. And as you can see on this x-axis, going through those first few stages, the foundation to the first post-secondary and to the second credential, that's a significant amount of time, but there is definitely more time after that in terms of leading and advancing, trying to link your development in your career with your study, and really kind of having a synergy with lifelong learning and making changes in the system, and then using that to learn and having that sort of synergy between the two. So we're really focused on that sort of middle stage emerging professional and beyond. And that's really the focus of our program. Okay, career paths. Once again, the traditional path is fairly linear. Nowadays, there's a lot of movement between different areas. Sometimes people would change from one health authority in British Columbia to another health authority, change provinces, change countries, or go from a frontline clinical role to being involved in a project, organizing projects and resources and people, maybe going back to clinical, maybe going from clinical to teaching, and then from teaching back to clinical, and many different pathways, even going out of the workforce and coming back. So things are certainly more complex, and it kind of reflects the reality of a dynamic sort of world. So that brings us to the Health Leadership Advanced Certificate at BCIT. What is this program for? So the program is fully online. There are 8 courses in the program. It's spread over a 2-year period. The level of study is upper baccalaureate level, and the program is underpinned by a competency framework, a capability profile called Leads in a Caring Environment, which was first developed at Railroads University in Victoria and has since spread across Canada. And it's also referenced in Accreditation Canada for health organizations, referenced in various national professional association bodies, and also in some job descriptions. After completing 4 courses out of the 8, you would receive a statement of completion. It's kind of a symbolic recognition of getting to the halfway point in the program. And then after all 8 courses, you would be awarded the Health Leadership and Advanced Certificate. To enter into the program, the minimum entrance requirement is having a health sciences diploma or a bachelor degree. The health sciences diploma would be in health. The bachelor degree can be in any other field or health or higher credentials, and an English proficiency equivalent to 73% grade 12. But what's really important here and what's really essential for success, and I'll explain more about this why later on, is to have relevant full-time work experience in the health sector where you can see the issues and relate those issues to your study and your study back to the workplace. It's super important for this particular program to be gainfully employed in the area that's relevant to the health sector, and ability to take the lessons learned and to apply it in the workplace, and to have that synergy and possibly even to bring some of the learning back into the classroom to enrich the learning environment. So the courses in the program, like I said, it's divided into 2 years. The first year, the focus is on a fundamentals course for emerging health leaders, looking at one's definition of leadership, what we aspire to and appreciate in leaders, and where leadership development is going in the health sector. Second course is on the Canadian health system. It's a health policy course. If you did a BA or a BSc at Simon Fraser University, for example, or did a baccalaureate nursing program, say at UBC or BCIT, and maybe some other professions, you might have encountered a Canadian health system course, or maybe a different term for that, Canadian health policy course. This is very similar to that. And if you did have one of those courses, you can get a transfer credit to this program. The third course is on leading people in healthcare. The fourth course is a financial management with a focus on sustainability course. In the second year, the first course is on performance measurement and management, so program evaluation and corporate performance. There's a course on evidence-informed decision-making. So if you have a clinical background, you probably encountered the notion of evidence-based practice, where you look at the scientific data, studies, and kind of come to an evidence-based decision on some clinical matter. This course is similar, but the substance of the course is from the health services management and organizational behavior literature, which is kind of a different ball of wax, because organizations are really complex, and it's really challenging to be kind of an objective observer outside of the system when you're in the system itself. So this course is a very interesting course, how to take that critical thinking that you've learned from a scientific health sciences and clinical perspective, but learn more about health services management and apply that to problems and issues in the workplace. The next course is project leadership in healthcare. And the final course is a integrative leadership project. This is a capstone project that you do in a workplace, your own workplace usually, with a sponsor, and I can speak more to that later. You'll also see here that 3 courses have this red star beside them, and I'll speak to this more later. Basically, these 3 courses with the star, these are available to people even when they're not in the program. The program is of interest to other parts of BCIT, so some courses are offered as electives. So we actually open these up for all participants to take without actually having to be in the health leadership program. If you did complete these courses, let's say you did the fundamentals course or the project leadership course, and then you decide, oh, I really want to apply to the program and get started, we will honor those credits to add on to your program, and then you'll have 2 less courses to complete by the time the program is done. So in terms of coursework, people do individual work as well as team projects. If you're the kind of person who only don't want to do individual work, so you get your assignment, you do your work, you submit it, don't need to talk to anybody, this is probably not the right sort of program for you. It is a program on health leadership, so working with and through others is a key element of the learning process. But obviously that involves risk because now your performance, your grades are kind of dependent on your team, but that sort of reflects the reality of day-to-day life. So we have a mixture of learning activities within the program, from small individual work that you do by yourself to big projects that you do by yourself, to some group exercises that are kind of small and some that are big, like a large case study of a reorganization of a long-term care facility, for example. So individual and teamwork as part of a program. So the final course, this is the one that I mentioned, the integrator project that one does with a sponsor. This is a very special course. It comes at the end of the 8 courses in the program, and it's called an integrator project because it's an opportunity for the learner to think back to the last 7 courses that were taken and integrate the learning with a practical quality improvement issue or problem to solve in the workplace. And in addition, you're not just solving something on paper to satisfy yourself or your academic instructor, but to have a real organizational actor, an executive sponsor, an organizational sponsor involved, something like a customer who's really interested in seeing, what is it that you recommend out of doing this project. So like I said, there are 3 roles involved: the student who does the work, the facilitator who helps to ensure that it's done in an evidence-informed manner and provides support to the student, and the organizational or executive sponsor who acts kind of as a sounding board, but also as a kind of an authentic, interested customer of the work that's being done. In addition, there's a 4th optional role. We call this a subject matter expert. Sometimes when doing a project like this, it's a really great opportunity to, go talk to the BC Quality Safety Council, or maybe speak to that standards body from Accreditation Canada, or maybe in a regional imaging area that there's a kind of a person who you really wanted to get in touch with who knows something about standards, maybe to involve them on a project. So this is an opportunity to get some leverage from your academic studies to kind of widen your relationships in the health system, as well as show your sponsor what you're capable of, and using a course like this for advancing your career. So in terms of what people focus on for the integrator project, this is something like a consulting project in the workplace. People often focus on a domain area that they have expertise on. So on the left, you'll see different clinical areas. And on the right, you'll see different sort of problems that are being solved, things to do with workflow or process improvement, information management, sometimes like evaluating the performance of a program or a policy. Healthy workplace has been a very important topic in the last few years because of the pandemic and the heavy burden on health professionals and the constant challenge. Training on onboarding, this is really important in some areas in particular. I know some of the medical laboratory in the profession, there's a huge challenge of developing the next generation of lab techs because the current generation is sort of retiring, and this whole process of training and onboarding and organizational memory is super important. Standards and guidelines, organizational change, reorganizing organizations, patient voice, that's another piece that's also really important. So you can see from the domain areas coupled with various categories of problems to solve, there's a lot of opportunities to engage in an integrated project to showcase the learning from the program and to use that as a lever to advance in one's career. And here are some topics. I'm not going to read these out, but if you just kind of glance through, you'll see that each project topic is fairly nuanced. And this is often because projects are related to the organization and also where a person is at and where their focus is at the time. Some interesting ones here, sustainability and spread of PHSA-based physician quality improvement projects around BC. CT imaging guidelines for pediatrics. There's one standardized patient self-medication administration procedure, and so on and so forth. Next slide, please, Darren. Some other ones here, reducing risk of falls in frail elderly, using methods like Lean to optimize processing pre and post analytical laboratories, patient identification. So the faculty in the program are faculty in the School of Health Sciences, full-time faculty and adjunct instructors from the health system. All the faculty have director and more senior level roles in the past or currently, master's degree and above, and some have additional qualifications like a CHE, Canadian Health Leaders certification. And there's a diverse range of experience and perspectives. Endorsements from the College of Health Leaders and the Emerging Health Leaders. Partnerships with various programs. So within BCIT, the courses in health leadership are used in the Bachelor of Health Sciences degree completion program in MRI, used in the Digital Health Advanced Certificate based on our school, used in the data analytics program that's based in the School of Computing and Academic Studies. Bachelor of Technology and Technology Management. This is a program, it's intended for people with technologist backgrounds to complete and get a degree, but it's focused more on the vendor side of the technology world. So not the hands-on perspective, but the producers and the suppliers of technologies into the systems. Some people may find that one way to advance in a career from going from a kind of a hands-on frontline delivery is to jump ship and go over to the vendor side, learn about products and services, learn about how these things are developed and produced and sold, and then come back to the services side to kind of bridge that perspective together, maybe be involved with purchasing or technology management and so on. Another program at BCIT, Project Management, is based in the School of Business. And they use our health leadership, project leadership course to kind of enrich the perspectives that those students get if they're interested in healthcare. So we've got really great internal partnerships and affiliations, as well as with the Emerging Health Leaders Group, which is kind of a grassroots organization, and Royal Roads University, which we share information with in terms of where programs are going and how we're using the LEADS framework and so on. So in terms of the annual course schedule, our department is, we focus on working health professionals. We also understand that some courses are used more often than others because of the topic area or the specialization. So this is the annual course schedule. You can see if you look at the green boxes, the program runs on a 2-year schedule and is optimized around a January start. So for example, a person could start in January 2024 and complete 7110 and 7120 as 2 courses to begin with. And then in April, they'll take 7130. In September, they'll take 7140. The next January comes around, they could do 7250 along with 7260, so doing 2 at once. Then in April, do 7260, and then the final course at the end is 8280. So that would be 8 courses over a 2-year period. And you could also see here that there are these additional cells in gray. So what this means is that certain courses like 7110, the first course in the list, is offered 3 times per year, every year, forever. And some other courses like 7120 are offered twice per year. So in January and September. And then others like 7130 are offered only in the April terms. So this is our annual schedule. We have it on the website and we basically roll it over each year without changing the timing. So what this does is it lets you kind of look ahead and plan your life around the program schedule. And if you do need to take a term off, or you are in a place in your life where you could actually accelerate your studies and go through more quickly, all the information is there to help you plan your timing. In terms of the budget for the program, it's around $8,158 spread over a 2-year period for 8 courses. So it's about $1,000 per course with all the components involved, the textbooks and so on. You'll see that if you look at the column on textbooks, it's higher for the first course, and that's because there's some resources in the first course that you'll be using in other courses in the program. Some courses, like 7250, have no text, and that's because all the materials are provided electronically in the course. And some of these courses, there might even be 2 texts, where one is an open source book and the other one is a paid book, and taken together that constitute the required reading materials for the program. So there's a range, but on average it's around $64 per course for textbooks. And there's many different ways to access your texts. So in terms of how a program like BCIT's Health Leadership Advanced Certificate compares to other areas of study, this is a kind of an XY chart to just kind of do some comparisons. So if we take the Advanced Certificate as the baseline, and if you compare back to the undergraduate level of study, the tuition fee for this course is higher than the previous level of study, because those undergraduate level studies were partially subsidized by the tax dollar, and people really need to be able to get into a career. And if you compare the Health Leadership Advanced Certificate to executive and master's degree programs, those programs are around 2.5 times or higher in terms of the tuition cost per credit. And that's because of the sort of premium environment and experience that are cultivated for programs like that. The EMBA at SFU, I understand, at UBC, I understand, is around $60,000 for a program, but those are generally sponsored by one's employer, and it's kind of very prestigious and exclusive. BCIT's approach, because we have a kind of a broad provincial mandate and also the nature of our own undergraduate learners, the aim is to be kind of middle of the road in terms of the way the pricing works, and to be very accessible for a positive change in the health system. On the x-axis at the bottom, just comparing entry to practice, so the kind of learning that you do at the beginning of your career as compared to what you do as a working professional. We're clearly on a working professional side. So taken together, it's accessible learning for working health professionals. Okay, let's talk about expectations. There are 2 ways that we think about expectations. One is for those who are interested to study in health leadership, the next step that they would need to do is to review the information, apply, and get formally accepted into the program. And then as a learner, you would be on our top of our list in terms of communicating conference opportunities or updates. We kind of know who our students are, and we would communicate directly with those. Another way that you can take courses in the department is to take a course as an undeclared major. So this means taking one of those courses with the little red star beside them. You can take a course, maybe you really needed to get that project management course done, but didn't really have time to do the whole program. Just do the project management course. We would consider you to be an undeclared major, not one of the accepted students. You may or may not receive that sort of update about things that are happening at BCIT because you're not on our kind of the inner circle of the list, but certainly you'll be able to get some studies and maybe decide if you really do want to do the program at some later date. So that's how we think about our students. We have students who are accepted into the program and a few students who are studying as an undeclared major for the time being. If your goal is to be accepted into the program, the first milestone is after you are accepted to take your first course. Don't get accepted and then not get started. It's really important to get started after you get accepted. Within the first year, you should try to complete the first 4 courses and get your statement of completion. You can tell your family, your friends, your employer, yeah, I made it to the halfway point and they gave me this informal statement of completion. So that's something to celebrate. But around that time, you should also start to think about, now, what am I going to do for my integrated project? Who is my sponsor going to be? What topics are really important? And how could I situate my studies over the next year to kind of prepare me for doing that project at the end? And then the last milestone is the completing the integrated project and get your advanced certificate from BCIT. And for people who are focusing on study just as an undeclared major for now, I suggest to try to take a course every term or have a chat with me to talk about your goals and how things are going. It's always good to stay in touch. As a working person or a professional, you probably have many commitments, and just having a chance to touch base with BCIT every once in a while helps us know where you're at, but also can help you with your goals and achieving your objectives. Okay, so next steps, you can apply to the program at any point in the year. Program advising is available at BCIT to help individuals kind of plan and take referrals, as well as a department. We have quite a bit of information available on our website, as well as a booking system where you can have a talk with somebody. Okay, let's go through a little quick here. This is just a testimonial from a student, X-ray technologist, Vancouver Island, talking about how easy it is to get so caught up in one specialty after a few years. It's good to interact with people from other backgrounds. This person, she preceptor and basically mentoring new nurses into the profession, seeing this as a way to advance one's leadership. Only 2 years in a leadership role. This is a nuclear medicine technologist, 8 years of experience, 2 years in a leadership role, a novice leader, but it's kind of tough because being the youngest member of the department. So leading people who are more senior than you, because of the energy perhaps that you can bring to the role, or maybe the only one who wanted to be a leader, which is also a very interesting place to be. Another example of being a young leader who supervises staff who's been in the field longer than she or he has. Okay, so that's the end of my presentation. Hopefully I've covered kind of a broad range of information for you. We will be making this deck available, as well as the recording will be on the website. But now is an opportunity for some Q&A. And I see questions have been coming into the chat. So how about if any of you would like to ask a question, feel free to turn on your microphone and vocalize your question, and I'll answer them as well. I'll be reviewing the chat to see if there's some questions that I can answer verbally. Well, let's hear from you. How did that sound to some of you? I see an interesting question in the chat. Hi, everyone. Is this program focused only for those who already have a background in the health system, or is it possible to start learning it at BCIT? So if a person has a health background already, but just not in the British Columbia or Canadian health system, I do suggest to take the Canadian health system course, because you can get into that course a la carte, so you don't need to be in the program. You can also interact with the classmates in the course who are working health professionals, so kind of studying the Canadian health system from the inside perspective, and also kind of confirming if an area of study like ours it would be the right thing for you. So those are sometimes when you're trying to make an important decision, it's good to gather some information, and gathering information on paper is one thing, but getting a taste of the experience is another. So that's one suggestion in terms of strategizing of how to organize one study. So the courses in the program that are going to be taken a la carte, there's 3 of them. Those are some ways to get started in the study, and maybe to start answering the question of how to get situated for the program. It's important to be in the right context by the time you get to the end of the program, because the 8th course in the program is the integrator project. and as a program that's for advancing professionals in the health system. We don't find you the capstone projects. You kind of, from experience and talking with people, you kind of know what some of the really important issues are and maybe some of the pain points that are in organizations. And so by the time you get to that capstone course, you should pretty have a good idea of what to focus on. You develop a proposal, get it approved by BCIT, get it approved by your sponsor, and then you'll do this consulting project in the workplace for credit. So we can't really create that context for you through BCIT because it's the workplace, it's not the academic environment. So it's really important to be in a good position in order to do a program like this. And if you're not in that position, there are a few courses you can take to kind of get you started in that direction. And then maybe at some point you can evaluate if you want to do the rest of the program. It's going through the chat to see other questions that came up. Other questions from those of you who are on the Zoom today? Feel free to turn on your mic to vocalize the question, or if you prefer to just use chat, you can type your question into the chat and I'll repeat it back and answer.
Jan?
Yes.
Hey, I have a question. How strict are you guys on the 2-year timeline to complete all 8 courses? Or do you work with people kind of on a case-to-case basis?
The latter. So all of our published materials say two years, and the reason is to hold the bar high. So people set the expectation and the goal that, yes, I'm going to complete in 2 years. But the reality is things happen. There are fires in northern British Columbia. There's been floods. There's been COVID. People, change jobs. Family situations change, dealing with aging parents. A lot of things can kind of take a plan of study and take it off the rails. So we absolutely do work with individuals to update a plan when the new information comes out. And so the way we do that is we basically grant a kind of a 1-year extension when those situations emerge. So the way that a person would navigate that is they would email Victoria Banham, who's a program assistant, or myself to say, I need to kind of update my program end date, and we would go through a process of doing that. There's no fee, there's no negative sort of implication or anything at all, but it's just really important to be clear-headed about it and to document it so that BCIT and our department knows where you're at. We're here to be kind of a quarterback to kind of coach you through the process. So when you're able to disclose and really say, I really need this extra year for these reasons, then we're here to help you with that.
Great, thank you very much.
Great question, Carrie. Yeah, also related to some of these sort of timing issues is the workload. Like, how hard is it to do a program? Maybe you haven't been in school for a while. What is it like to do, 4 courses over a year? I would say 80% of people are pretty good with doing 4 courses over a 2-year period. It's around 7 to 9 hours of effort per week per course. And it's somewhat comparable to what you might have seen back in your first credential. Let's say you were in a university, you're doing psychology 101, Monday, Wednesday, Friday for an hour. So that's 3 hours a week. And for every hour you're in class, you do another an hour or 2 at home. Taken all together, that's kind of the estimate of the workload, which is quite similar. So 7 to 9 hours. And that includes reading, thinking, writing, doing assignments, maybe doing some coordination with your classmates if it's a group assignment, engaging in online threaded discussions, maybe jumping on a Zoom call with the instructor informally. So there's a wide variety of activities that are involved in that timing, but we do ask people. Our courses are 12 weeks long. So on week 6, we ask people about the workload. And then at week 12 at the end, we also ask again about the workload. And statistically, it's around 7 to 9, which is right on the target of what we expect per course per week. Darren, thank you for sharing this slide. I know there's probably some other questions. This is how to get in touch with our department, healthcare management, based in the School of Health Sciences. You see my name there. Sharon Jadzaglu and Victoria Banham is listed there, program assistant. Please quote your student ID, your course of interest, and your program when you inquire with us. Don't just say, hey, what about this? Just, probably let us know who you are so we can connect the dots. But we also we're piloting a new system for bookings. So if anyone needed to have a meeting with me, upon request, we can send you the booking link, and then you can schedule a time when I'm available. So no more sort of a phone tag or email tag. You can book a meeting just like how you would book a dentist appointment or a COVID shot.
Thanks, Shan. I think that's it. We're kind of out of time. We have
Okay.
one more just a reminder about program advising. Please contact program advising if you have a question or unsure of something, and they can answer questions regarding entrance requirements, the application process, student resources, success strategies, and program schedules and other things. And of course, we would love to have you connect with us on any of these socials networks, Facebook, Twitter, Instagram, YouTube, TikTok, or LinkedIn. There's a lot more to be learned on the bcit.ca website about tours, spend a day, big info and other info sessions, as well as advising. And that definitely takes us to the end of our presentation. I want to thank Shan for all his great information, Victoria for her support, Bavina from Program Advising, who was watching the chat. And of course, we want to thank all of you for being with us today, and we wish you all the best in your future in health sciences or leadership, or whatever you choose is best for you. So thank you once again. A copy of the slide presentation and a link to the info session video will be sent out to all registrants in a week or two. And we thank you very much for being here. Hope you have a great rest of your evening. Thank you, everyone.
Thanks, everyone. Bye.